Coming up this week on Talk with Audrey, a recent survey shows that rising out-of-pocket costs are preventing people from accessing the important and necessary dental care they want and need. Bobbi Rebell is a certified financial planner and founder and CEO of Financial Wellness Strategies. She has some advice on how people can plan ahead to better manage dental cost. You've probably heard of the term bad cholesterol, but did you know that too much of it can increase your risk of heart attack and stroke? Dr. Eduardo Sanchez, Chief Medical Officer for Prevention for the American Heart Association, joins me, and we're going to talk about how people who've had a heart attack or stroke can best manage their LDL cholesterol and reduce the risk of repeat cardiovascular events. Major depressive disorder, or MDD, is one of the most common mental disorders in the U.S., according to the recent Centers for Disease Control and Prevention. Cami Harris is a board-certified physician's assistant in interventional psychiatry in Raleigh, North Carolina. We're going to talk today about what people can do if they're struggling with their depressive symptoms. And joining me to talk about the relationship between opioid addiction and the spread of hepatitis C, Dr. Stewart, a family physician at Eau Claire Cooperative Health Centers, and Devin Lyall, Executive Director of a nationally recognized recovery community organization. It's all coming up this week on Talk with Audrey. Insightful, intelligent, and inspiring conversations and information to help you improve the quality of your life. It's all about the business of living. I'll be right back after this. You're watching Talk with Audrey. Welcome back. A recent survey shows that rising out-of-pocket costs are preventing people from accessing the important and necessary dental care they want and need. And since dental health is key to overall health, what can people do to financially prepare for out-of-pocket dental care needs as well as unexpected dental emergencies? Well, Bobbi Rebell is a certified financial planner and founder and CEO of Financial Wellness Strategies, and she has some advice on how people can plan ahead. And she's also going to connect you with some of the tools and resources to better manage your dental cost. Thanks for being here, Bobbi.
Thank you so much for having me, Audrey.
Yeah, boy, I tell you, every single time you think about going to the dentist, it's like, well, okay. I mean, you could even start grinding your teeth at night just thinking about it, right?
I know, it's so, that's actually right on target because it is enough to cause so much anxiety. So that's why it's so important that we're speaking about it today. Synchrony did a dental lifetime of care study, and they found, and you're alluding to this very well, that Americans, we are so afraid to go to the dentist that we put off our dental care. 58% of Americans feel that it is simply unaffordable these days. That's pretty compelling, by the way, and that's with insurance. People that don't have insurance, that number goes up to 75%, Audrey. So this is something you are right on target to be spotlighting. So thank you for that.
And you're very welcome, because it's something that most of us worry about. The cost of a filling, or if you need a root canal, it's just everything. And if you don't have a clue what it's going to cost you, you don't know where to go to find out how much it's going to cost you. And if you don't have insurance, well, that's a whole nother thing.
So the costs, we do have an answer to what you were basically mentioning there. The costs are really staggering. So for just a single person, for a lifetime of basic dental care, you're looking at more than $50,000. When you get down to couples and families, you're looking at more than $95,000. So we're getting close to the six figure. And Audrey, that's just the basic stuff like you were talking about. That's not counting the big stuff, all the fun stuff like dental implants and orthodonture and root canals and all of that extra bonus stuff that often come our way when we don't pay attention to our dental care. So the numbers are really scary.
Oh yeah, it's a staggering number, but delaying that dental care could have a greater impact on your health down the line. So what can people do to better plan and prepare?
Exactly what you said, plan and prepare. So we want to talk about emergency funds. We do allocate money for things like vacations and retirement, all of the things. I want people to be allocating money for dental care in kind of a separate budget. You can put that in a money market and a high yield savings account. The good news is with interest rates so high, which I shouldn't say good news in the same sentence as that, but the good part of that is that you can get a pretty decent return in those funds, and Synchrony does provide money markets and high yield savings accounts. You also can take advantage of pre-tax options through your employer. I'm talking about things like flexible spending accounts and also, for example, a health savings account. Many companies will literally give you free money if you fund your health savings account. People should be aware, for many companies, that open enrollment period is coming very soon. So please, everyone, pay attention. And then, as we know, unfortunately, in the moment, we don't always have the money right there ready for us. So health and wellness credit cards like Care Credit can be an incredible tool to have at the ready. For example, there are promotional financing options, like if you qualify, you could possibly have deferred interest. That's really important with interest rates the way that they are right now. And you also can do budget-friendly things like spreading payments over time as long as 60 months. That can really help in terms of your financial planning, your financial wellness, and that all leads to what we all want to get to, which is dental health and wellness for all of us.
So, Bobbi, where can people go for more information?
Thank you so much. Go to dentallifetimeofcare.com. That's dentallifetimeofcare.com. Lots more information from this very compelling study that Synchrony did, the Synchrony Dental Lifetime of Care study, and also lots of things to motivate you and give you resources so that you can be ready for the dental care that you're going to need in your lifetime. So thank you so much.
My pleasure. And everyone, remember, you want to financially prepare for out-of-pocket dental care needs and any unexpected dental emergencies. So be sure to keep that top of mind too, because the health of your mouth really does have an impact on the rest of your body. So it's something to really, really think about. Bobbi Rebell is a certified financial planner, founder, and CEO of Financial Wellness Strategies. She's given us some great advice. Bobbi, thanks again.
Thank you so much for having me.
There's more to come on Talk with Audrey after the break. Welcome back. Well, you've probably heard of the term bad cholesterol, but did you know that too much of it can increase your risk of heart attack and stroke? My guest today is Dr. Eduardo Sanchez, Chief Medical Officer for Prevention for the American Heart Association, and we're going to talk about their Lower Your LDL Cholesterol Now initiative. And he also has some tips on how people who've had a heart attack or stroke can best manage their LDL cholesterol and reduce the risk of repeat cardiovascular events. Welcome, Doctor.
Hi, how are you?
Well, how does someone know if they have high LDL cholesterol, and what should they do if it is high?
Well, really, the only way to know that your LDL cholesterol is elevated is to have a blood test done, usually ordered by your doctor or healthcare team. And then once you have that information, having a conversation with your physician about what that means, and is that LDL cholesterol sufficiently low to reduce your risk of a heart attack or stroke.
So the LDL is the bad cholesterol.
The LDL is the bad and the HDL is the good. So LDL should be lower and HDL should be higher.
Is there an optimal number for LDL and one for HDL?
I think the really important thing is for persons to get their test done and then have a conversation with their doctor, because the characteristics of a patient make the level to which one is trying to target that lower LDL slightly different. So persons who've already had a heart attack or stroke have a lower target level than persons who may not have had a heart attack or stroke. So the really important thing is get that done and go talk to your doctor. And there might be some guidance around high, medium, and low, but the truth is talk with your doctor and have a conversation about what that means for you as an individual.
The American Heart Association recently conducted a poll to gauge public understanding of LDL cholesterol, especially among those who've already had a cardiovascular event. What did you learn from that?
So that poll was conducted by Harris, and it was supported by the American Heart Association and Amgen. And yeah, that poll was really, really interesting. Among these persons who'd already had a heart attack or stroke, 3 out of 4 of them reported having high LDL cholesterol, but only half of them knew their LDL cholesterol level or even what range it was in, and more than half of them said they weren't currently prioritizing that elevated LDL cholesterol. That is cause for concern and for a call to action. That's why this initiative is happening. People should know their LDL cholesterol, but people who've had a heart attack or stroke, really, really important that they know it, and then do the things that need to be done to lower their cholesterol as quickly as possible.
What does elevated cholesterol do to your body?
When LDL cholesterol is high, it basically accumulates. It starts sticking to the arteries in a person's body. And when too much of it accumulates or sticks on, it can reduce the flow of blood to important parts of the body, the heart and the brain. And if way too much accumulates, it can totally block the flow of blood. When it happens in the heart attack. When it happens in your brain, stroke. Those are bad things. The good news is, knowing LDL, lowering LDL can reduce that accumulation and reduce the likelihood that such an awful thing might happen.
All right, I'm trying to picture all of that accumulating in arteries and veins.
Well, think of a hose. Think of a hose that you can collapse, and while collapsing it is coming from the outside, the effect is the same. You can block a hose to where no water's coming out on the other end. That's a heart attack or stroke if it's your coronary or cerebral arteries and it's happening from the inside.
And what can be done to lower the LDL cholesterol levels and sort of clean out the hose, if you will?
The most immediate way is to be on medications that help lower LDL cholesterol levels. And why that's really important is that the risk of a heart attack or stroke almost immediately comes way down. And so one can immediately change the likelihood that a bad thing is going to happen in the future. There are some things that can be done with physical activity and dietary change. Those take much longer to happen and take a degree of discipline that takes a while to get to. So really, really important that the message is know your LDL, lower LDL. It is probably, in the case of most people, going to require medications on the front end and then some modification perhaps as time goes on.
Doctor, where can we go for more information?
One can go to heart.org/LDL, where you will come to the Reduce Your LDL Cholesterol Now website, sponsored by Amgen, presented by the American Heart Association in the name of longer, healthier lives, as you said.
All right, everyone, so let's get our cholesterol checked. My guest has been Dr. Eduardo Sanchez, Chief Medical Officer for Prevention for the American Heart Association. As always, be sure to consult with your doctor. Dr. Sanchez, thank you so much for joining me.
Thank you so much for having me.
I'll be right back. This is Talk with Audrey. Welcome back. Clinical depression, it's also known as major depressive disorder, or MDD. It's one of the most common mental disorders in the U.S. according to the recent Centers for Disease Control and Prevention, and approximately 1 in 5 U.S. adults reported receiving a diagnosis of depression by a healthcare provider. Cami Harris is a board-certified physician's assistant in interventional psychiatry in Raleigh, North Carolina. We're going to talk today about the signs and symptoms and challenges of treating depression and what people should do if they're struggling with their depressive symptoms. Welcome, Cami.
Thank you for having me. Clinical depression is very, very common. I think that everyone under the sound of my voice either knows someone or they themselves have experienced what it feels like to be depressed. It's also something that carries a lot of stigma, so it's underreported. A depressed patient usually doesn't want to go anywhere. They don't want to do anything. They want to self-isolate. And oftentimes they experience crying spells, feelings of guilt, and changes in appetite and sleep. Unfortunately, this patient has become hopeless.
And it's that hopelessness that I think most people recognize. I understand that some depression is treatment resistant. So if you go to the doctor and you're prescribed medication or therapy, what makes some types of depression treatment resistant?
Okay. So to earn a diagnosis of treatment-resistant depression, you simply have to fail at least 2 antidepressants. And if anyone knows anything about psychiatry, that is really not hard to do. In my clinic, I see treatment-resistant depression patients every day, and I am using Spravato, which is an S-ketamine nasal spray, and it works differently in the brain than any other medication. And they're getting better, and they're getting better faster. And that's why I'm happy to have partnered with Janssen today to bring awareness to this. And then also I want to let you know, like with any medication, it can carry side effects and risks. So you want to reach out to your healthcare provider.
Oh, that's unique, because typically if you're taking one of the more traditional medications, it comes in pill form, right? And it also takes a while to sort of kick in to help you with your depression. So does Spravato work faster than those treatment options?
So in my experience in my clinic, yes, it works faster than an oral antidepressant. You know, oral antidepressants can take 4 to 6 weeks. It doesn't take that long for Spravato. But again, each patient is different. I want you to talk to your healthcare provider and just get more information to see if you're the right candidate.
Absolutely. And if someone is struggling, or they know someone who's struggling with symptoms of depression, what can they do to get on the right track to getting treatment?
Well, I think the first thing to do is to take that big step to get help. Secondly, be an active participant in your care. Partner with your healthcare provider. Take ownership. And lastly, and this one is often taken for granted, have a mindset that getting better is actually possible. Because how can you get better if you don't believe it's possible?
What would you suggest? Physical activity, working out, walking, trying to be out with your friends and family members as much as possible?
Yes. So one of my favorite things to tell people is use your secret weapon. And your secret weapon is exercise. Because what it actually does is it increases the body's natural antidepressants. So that's one way that you can boost your neurotransmitters on your own.
Where can we go for more information and resources?
So obviously you want to utilize your healthcare provider. If you are currently feeling suicidal or having a crisis, please call or text 988. If you want more information on treatment-resistant depression, you may visit Spravato.com.
If you think you're depressed, don't suffer in silence. Check with your healthcare provider, talk to your family members, and get help. My guest has been Cami Harris. She's a board-certified physician's assistant in interventional psychiatry in Raleigh, North Carolina. She's talked with me about the signs and symptoms and challenges to treating depression, and what you can do if you're one of those people struggling with your depressive symptoms. Cami, thank you so very much for joining me and for the facts.
Thank you, Audrey. I appreciate it.
I'm going to take a quick break. I'll be right back. You're watching Talk with Audrey. Welcome back. Opioid addiction continues to impact communities throughout the country, and advocates are encouraging testing and treatment for hepatitis C. Joining me to talk about the relationship between opioid addiction and the spread of hepatitis C, also known as HCV, and how we can help stop the rising cases, Dr. Ada Stewart. She's a family physician at Eau Claire Cooperative Health Centers, and Devin Lyall, Executive Director of a nationally recognized recovery community organization. Welcome to both of you.
Thank you.
Thank you.
Well, this is surprising, I have to say. I was hoping that opioid addiction was on the downswing, not the upswing. Devin, let me start with you and your story and the work that you do in your community.
Yes, thank you, Audrey. So I'm brought to this work because I have my own story with addiction into recovery, and a huge part of my story was being impacted by hepatitis C, and then, of course, being cured. But I became addicted to opioids after an ankle injury where I was prescribed opioids long term, and my disease progressed, and eventually I became an IV drug user, and due to that acquired hepatitis C. And so I come to this passionate about this conversation because I think we need to raise awareness around hepatitis C. Let people who use drugs know that there are harm reduction services similar to the ones our organization has, with syringe service programs and naloxone distribution and safer use supplies and counseling. And so we really I'm glad to talk about this because I think there's too much stigma, and these conversations I think will help people get resources and access to the care that they need.
Dr. Stewart, please tell us more about hepatitis C and the relationship to the issue of opioid addiction.
Yes, so thank you so much for that question. And, Devin truly highlighted the importance of recognizing the relationship between opioid addiction and the opioid epidemic and hepatitis C. So hepatitis C is known to be the silent disease. Most individuals don't have any symptoms until later on when complications arise, things such as liver disease, cirrhosis of the liver, liver cancer, and even death at times. Hepatitis C is transmitted through blood. It's blood-to-blood transmission. And so that's why it's really important to recognize the correlation, the relationship between IV drug use and hepatitis C. We've also seen a doubling of the spread of hepatitis C over the past 10 years due to the opioid epidemic. Sadly enough, we right now have 2 million individuals estimated to be living with hepatitis C, and about 40% of those folks don't even know that they have hepatitis C. So it's important to recognize how it's transmitted via blood and how it is important to be screened and tested and potentially cured of hepatitis C once you find that you do have it.
So someone can get it and not know that they have it.
Yes, because it is silent. There's no signs or symptoms until much later on, many times.
And by that time, you might have a much more complicated case. What about treatment options once someone is aware that they have hepatitis C?
So it's really important to get screened and then find out if you do have hepatitis C or not, and then reach out to your healthcare provider. It's important to be linked to care. There are available treatments out there, and your provider, your healthcare provider, will recognize which treatment is best for you. The treatments that are available now can give you 95% possibility of being cured. And, that's really important to recognize that we can cure one of hepatitis C. And for every one person that we cure of hepatitis C, that decreases the spread to about 20 other individuals who could be impacted by hepatitis C.
And we're not talking about just young people. We're talking about people across the spectrum. This is anyone who's using drugs that has the potential to become infected.
Yes, definitely. And it's really important, and Devin can really talk about this. It's important to screen everybody. The CDC recommends that every adult gets a one-time, lifetime screening for hepatitis C. But those individuals who are at risk, those potential individuals who, are IV drug users, we need to screen them much more. It's important, again, to recognize how important it is to screen and then be linked into care.
And I'll echo what Dr. Stewart said. We encourage everyone that comes into our recovery community center to get tested, even if they have been tested in the past. So we just encourage anyone and everyone to be tested, definitely people at higher risk. And that's why it's important for people to get connected to resources within their community, have these conversations with their primary care doctors and providers so that they know what their options are. Our organization says we need to meet people where they're at and provide the services that they need to, enhance their health and wellness. And so it's just really important if you have a loved one, if you have a friend, if you have anyone struggling with substance use, that you have this conversation with them and spread awareness and let them know that there are testing options and treatment.
Where can we go for some more information?
So you can go to hepvu.org, and that's HEPVU, V as in Victor, U as in under.org to get more information.
Well, I want to thank you both for joining me and Devin for sharing your story and for the work that you're both doing to help prevent the spread of hepatitis C.
Exactly. And we can't solve this opioid crisis overnight. So I think if we all work together and have these conversations like we're having today, that we can make a huge difference.
I agree. My guests have been Dr. Ada Stewart, a family physician at Eau Claire Cooperative Health Centers, and Devin Lyall. Thank you both for joining me.
Thank you so much for having us.
And that's it for this week's show. I'm Audrey Adams. Join me here next week for more insightful, intelligent, and inspiring conversations and information to help you improve the quality of your life. It's all about the business of living. I'll see you next week.